Accidents can happen at any point, and it's so important to be prepared and know where to go to receive the best care possible. So today I'm at Akron Children's Hospital, and I'm joined by Dr. Anjay Khandelwal, who is the director of the Adult and Pediatric Burn Institute. Thank you so much for stepping away from your busy schedule to join us.
No problem. Thank you for having me.
Yeah, so we're going to talk about some techniques that are really unique to Akron Children's Hospital, and we'll start with the minimally invasive, that burn surgery, correct?
Yes. So a lot of times when we think about burn surgery, it's what we would call very invasive. It's removing the dead skin and then covering that up with skin grafts. However, we do have a way that we're not necessarily removing all of the dead skin. We're removing just kind of the top layers of it. And so it's not as painful for the patients. It's less invasive for them. It's thereby safer for them. And we can get some really good results with that.
And there's been a new combination, right, that's going on here, again, unique to Akron Children's.
Yes, and so one of the things that we've done is that we've had a lot of experience with the spray skin, as many people know about. And what we have done is we've actually combined the two. So we have combined minimally invasive burn surgery along with the spray skin. And so for a lot of patients who need dressing changes on a daily basis or are in the hospital for a long period of time, we can minimize, and if not, in many situations, actually eliminate a lot of that as a result of combining the two technologies together.
And so, doctor, what are some of the benefits that you see when people use these two techniques combined?
Sure. So when we've utilized these techniques, so the minimally invasive burn surgery and the spray skin together, we've noticed a couple things. So number one, we've seen a decreased amount of time in the hospital. Number two, we've seen a decreased amount of pain medication usage. Number three, we've seen a 25 times greater likelihood of healing by just 10 days, as opposed to maybe 3 or 4 weeks. In addition, we've seen an 80% reduction in scarring. And so the benefits are great. The nice thing is, too, is we've shared this experience with our colleagues around the world because we were the first ones to kind of combine these two technologies. And it's been really fun to share them with colleagues around so that they, too, can adopt these techniques.
So who else would be a good candidate for this type of technique?
Sure. So there are patients who require traditional skin grafting if the burns are very deep. But for some of the burns that aren't that deep, once again, to minimize the amount of time that they're in the hospital and to prevent painful daily dressing changes, we can actually utilize this technique. It's good for adults. It's good for pediatrics. And like I said, it's really good for those middle type of burns.
And you do now treat adults here, you treat children, teens, you treat everyone, is that right?
We do. We take care of patients as little as 1 week of age, and we've taken care of patients older than 100.
Oh my goodness, it is something that, like I said, it can happen at any point, and to know where to go and to be prepared, it's so wonderful to have you guys here. Is there anything that folks at home should know about in regards to the techniques that we just discussed?
So I think it's important to if you do get burned at home, if that happens, seek medical attention. Know that there is an option, that there's other options that we can offer that are, like I said, minimally invasive. You can heal faster, you can get out of the hospital quicker, and there's a lot less scarring that's associated with this too.
Well, thank you so much. We are so grateful that you are here to help. And for everyone at home, for more information, you can just go to akronchildrens.org.